Sapien. Maverick Physical Therapy, welcome to a little issue in which we're going to dig into looking at functional hip mobility through some pretty interesting little assessments. Notoriously, this is stuff with the old goni. Some of you remember back to your second and third grade days where you had a little protractor and a compass and we took a bunch of measurements. I'm not quite sure I would be very successful in that setting anymore with those kind of equations and those things, but for the human body, this has been something that over the years has been used to assess mobility and judge individuals in non-functional positions on a table to give us this realm of this evidence-based practice. As you know, this evidence-based practice kind of notion is very limited in that it fails to take into account the functional capabilities of the individual. It doesn't, and there's no way to assess the courage, the endurance of that individual as well. But then also just based on a good functional position, it doesn't allow us to hypothesize the root of the problem based on how that patient's presenting in the clinic. So we have highs here today. I'm going to take you through what I go through and what I take my patients through with regards to an assessment when they come into the clinic, going after the hip. And we'll use this as a comparative tool later on in the treatment session for test and retest. A week from now, every treatment session, and for however long down the road as well, to keep us both honest with regards to, hey, how's my interventions, my implementations working with John, my FMR, my manual therapy stuff, the regimen that we've set him up with, but then also has been being consistent with his homework at home, doing the stuff that we've talked about so that we can collaborate in getting him better. So the first thing we're going to take a look at first is hip flexion. I like to go with an R, XX, and LXX stance, and I love to be able to measure the back hip with that guy as well. So my moving and stationary arm are going to be the same as they would be if I were on the table, which I'm not, but we're going to go greater trochanter in terms of the axis. My moving arm is going to go right up through the between kind of the ASIS and the PSIS, right up through the lateral ilium. Moving arm is going to go right on down the femur, so to the lateral condyle. So I'm on the greater trochanter right here, and the back leg loaded up gives us more flexion. That's why we're on the back leg. 120 degrees on the table is normal. And go ahead and stop for everybody. And let's go ahead and rock and roll one more time. So we have 145 degrees there. And relax for me. And we have 150 degrees there. We'll do a little comparison for the sake of symmetry. So let's go RXX, so right foot back, left leg forward. So we had 145 to 150. And with the right hip, I'm at the greater trochanter. And moving stationary arm is down the lateral epicondyle of the femur. And I've got 146, 149 right there. So pretty symmetrically balanced. I love with this next one, hip extension. So functional hip extension, we'll get out the old mat and we can use centimeters for this guy to see how much distance we can clear from big toe to heel. I'll say, highs, I want you to take a step forward for me, and I want your arms to reach overhead. Left foot needs to stay pointed forward, and the foot needs to stay flat. Good. And then back for me. And so when you step straight on out with that foot nice and flat the whole time for me, buddy. Popped up a little bit, that's all right. Let's go ahead and do that again. And so true hip extension, I'll look at making sure that hip stays nice and straight. Reference points again are going to be the greater trochanter. Stationary arm is going to be pointed down the lateral aspect of the femur to the greater, to the lateral epicondyle. And moving arm, so he's at 20 degrees of hip extension right here. And then let's go ahead and let's switch sides, buddy. Let's do the same thing right here. Left foot's going to step forward, right foot's nice and flat. There you go. And so you'll see a lot of times an early heel rise because of the hip not being able to get into kind of the extended position the way that we'd like it. So we'll go greater trochanter, it's the axis, stationary arm is pointed down to the lateral condyle of the femur, and the old right hip right here is weighing in at 25 degrees of extension. We're shooting up through the middle of the ASIS, PSIS through the trunk. And so that's actually more than the other day. It's about 8 to 10 degrees further than it was the other day. There you go, buddy. Perfect. Johnny, what we're going to do next, we're going to go after, we have a little ninja here on hand joining us. We're going to go after hip abduction, adduction, internal and external rotation. So the next thing I'll have John do, and I'll demonstrate, let's go a little same side frontal plane lunge, a little lateral lunge to the right. Arms are going to reach overhead to the opposite side. So we're cueing him to right foot slightly ahead of the left, load up into the right butt and hip. Reference points for me are still going to be bilateral ASIS. So I'm measuring the left hip abduction axis point is going to be at that left ASIS, and moving arm is going to go right on down through the femur. So when you're ready, I'll have you do a couple on your own. I always love to give the patient a couple to practice on their own, especially if it's something that they haven't done before. It's not really a good true assessment otherwise. So when you're ready, so I'm going to go ASIS, and hopefully you guys can see that. Well, ASIS. And just a matter of lining it on up, and so he's at 39 or 40 degrees of left hip abduction. And what we'll do next, Johnny, let's go ahead and do the same thing with the right hip. You're going to lunge into the left, and let's go with a reach overhead to the opposite side. So arms will reach overhead to the right for me. There you go. Do maybe one or two more of those. Good. And let's hold right there. There you go. And so right hip abduction is 48 degrees. And we'll talk in a few minutes about number-wise and what's normal on a table in comparison to the results we're getting right now. Let's go after left hip adduction. So right foot, opposite side, frontal plane kind of lunge. Arms will reach overhead in the opposite direction for me, buddy. And the biggest thing with these guys, that base foot needs to be pointed at 12 o'clock, 9 o'clock. And so I'll use the same ASIS as my reference points right here. Axis for the moving, or for the axis, is the ASIS on the left side. And so we have 23 degrees of left hip adduction. And let's go with the, you got it, left foot stepping over top of the right. So now we're going to go right hip adduction. There you go. And so we have 25 degrees of right hip adduction. So over the course of the past couple days with all of our FMR stuff, we actually haven't done a ton of that since Johnny's out of state. We've been giving him a lot of tools for him to use on his own. We'll get to what normal is on all these guys in a second, and I guess the contribution of motion. Actually, we could probably get to that now. So hip flexion, normal is considered 120 degrees on the table. John was 145 to 150 with both hips, and what that includes is that in a functional base position, you have a contribution from many other joints that are feeding into that. So we shouldn't just have 120 degrees normal. We should have something that's, because cumulatively speaking, we have a combination of things, be higher than 120. Hip extension, 20 degrees on the table is normal. He was the other day like at 15 and 18 or 15 and 20 degrees via the hips. Today he was anywhere from 23, I think 25 degrees for the hips. We have a contribution of motion coming from the foot, the ankle, the hip, but also then from thoracic spine and the lumbar spine. Hip abduction, normal is 45 degrees on a table. John was 45 to 50 degrees right here in a functional base position. We have a big contribution of motion from that abducted hip, also from the knee, as well as the foot and the ankle, as well as the thoracic spine and the lumbar spine. Adduction, kind of the same thing as well. I'll keep chatting as the old sprinklers went off, and we're kind of shifting. We've got ninjas shooting us with Nerf guns. It's all good and good stuff. Adduction of the hips is most typically 30 to 35 degrees is what is considered normal. John the other day went from like 15 or maybe 17 degrees, maybe 12 degrees on up to already like 20, 25, 26 right there. We're next going to go after internal and external rotation, both of which are 45 degrees is considered normal, but again, we need to think about contribution. We have a contribution of motion from other joints. So John, what I'm going to have you do, enough yapping, huh? Let's go left leg forward, let's go right tippy toe. I'm going to have you cross your arms over, and I'm going to have you rotate your trunk as far as you can to the left, and I'm going to have him do that a couple times on his own. So my moving arm, or my stationary arm, is going to point right to you, and so it's going to go basically that left ASIS, and what I'm doing is lining up the moving arm with the other kind of ASIS right through kind of the trunk. And so what we have here, we have 30 degrees of left hip internal rotation. A lot of times with this, you'll see like a femur that'll really bail on out, which a lot of times will signify a lack of dissociation between the pelvis and the femur, which we'll take into account for that with the goni in the position right here, and a strong top-down driver. So that was 30 degrees, Johnny, in the same position, buddy. Let's go left leg yet. So I want you to go external rotation for me, and then we'll go internal. You got it. Good. Let's do a couple more. And the same thing with my stationary, my moving arms. I'll go ASIS, and I'm just going to follow that over to the other ASIS and the anglage of the ilium and the innominate right there. And so left hip external rotation we have at about 35 degrees right there. Good. And now let's switch feet. So what we'll do, we'll go right foot forward and just tippy toe with the left. Bring your left foot forward just a little bit more for me, buddy. And so vast majority of the weight is on the right foot. The left is just a nice little help. Again, we'll find the right ASIS, and we'll point that right at you guys. And so stationary arm is pointed at you. Moving arm is following the other ASIS. And he's 22 degrees of right hip internal rotation. And now let's go external rotation right here, buddy. Do the same thing in terms of our position. I'll show him, I'll demonstrate to him how to do it, and I'll have him go through it actually a couple times. So I'll go ASIS is pointed forward, right towards you all. And so right here he has 55 degrees of right hip. Excuse me, he's got 42 degrees of right hip external rotation. So again, normal is 45, but we have a big contribution from the hips, the knees, that relative internal rotation and external rotation, a big contribution from the foot and the ankle, SI joint, lumbar, and thoracic spine. Functional way of assessing hip mobility. I would take that to the bank any day over than the crap that we learn to assess and judge people by on the table. We'll work at bumping those numbers on up because it's a good expression of us getting better, what we do, how successful we are. Guys, it was great working with you, buddy. Boom.
Touche, Nakawaki.
Cheers to, you got it right back at you. Cheers to furthering your genetic potential with the old goni in a cool way.